As a comparative, if you remember, there are certain things which are more common in your ulcerative colitis, there are certain things which are more common in your Crohn's disease, and there are certain things which are equal in both. So when we talk about more common in your ulcerative colitis, toxic megacolon, and primary sclerosing cholangitis. When we talk about equal instances, it is the incidence of cancer which is equal in both. When we talk about what are the conditions which is more common in your Crohn's disease, okay, then extraintestinal manifestations will be more common in your Crohn's disease. So this is again a very important table. Lastly, I will finish this discussion by comparing the Crohn's disease with ulcerative colitis. And if you know this slide, probably you will be able to answer most of the questions. So the most important is mucosal inflammation. So here mucosal inflammation is very characteristic. Okay, but here patchy transmural inflammation. So here the inflammation is only up to the mucosal layer. Here the transmural inflammation is there. Okay, here the width of the submucosa is reduced, but here we have seen that there is a submucosal increase. Okay, here there is increased vascularity, okay, and little edema, but here there is vascularity is not there, but edema is there. That is why this presents primarily with hematochezia. Here the GI is very friable. Okay, crypt abscess is more common here, it is less common, and that is why most of these patients will present with repeated fever. Granulomas on biopsy is not seen here. Here non-caseating granulomas are here. So that's why Crohn's disease is also called as your granulomatous inflammatory bowel disease. Fissuring is a hallmark of your Crohn's disease. It is almost never seen in your ulcerative colitis. Anal lesions are non-specific here, but here you can have granulomas, fissures in your Crohn's disease. Rectal bleeding is very common. Here dynia and tenesmus are more common. Palpable mass because of toxic megacolon is more common here, but here primarily the patient will present with colic pain. And remember, as I've told you, that cryptic abscess is more common here. It will present primarily more commonly with fever, and it generally reoccurs with surgery, but here reoccurrence is very less common after surgery. So these are important different comparison points between your Crohn's disease and ulcerative colitis.